Right now, with the testing that's available in Colorado, either through the state laboratory, through commercial laboratories that provide laboratory services to providers all over the state, and to now some of our major hospitals that are testing within their hospital laboratories. The focus is going to be testing on people who are hospitalized and are quite ill, healthcare workers who have illness and we need to make important decisions about their ability to work, and then people who are at risk for having a harder time managing this illness and at risk for having serious complications. So our seniors, our people with weak immune systems, individuals who have chronic health conditions. That's where we're getting a lot of the testing from at this point. And so I'm calling that the tip of our iceberg, right? So there's a part of an iceberg that's above the water and a part that's below. But what's below the water is a lot of other people. As Dr. Douglas mentioned, we know that perhaps up to 80% of people with COVID infection are going to have mild symptoms, and they're not necessarily going to recognize that their symptoms are actually due to COVID infection because maybe they don't feel so poorly. But what happens is as disease becomes widespread in our communities, which we believe is happening now, the bottom of the iceberg, which are the people who aren't tested or the people with mild symptoms, are pushing the top up. And so when we start seeing more severe disease and more hospitalizations and big strains on our healthcare systems, it is indicating to us that there is much more disease going on and being spread that we have not yet been able to completely wrangle in. So early on, so I'm going to just give you some quick numbers here. For example, on March 17th, we had 160 cases reported in Colorado from positive laboratory testing. Less than a week later, that was 4.5 times higher at 720 cases. A day later, it increased from 720 to 912 cases. This is a rapid rise in the number of positive tests that we are getting reported. In Tri-County's jurisdiction of Adams, Arapahoe, and Douglas counties, on March 17th, we cases. 4 days later, that more than doubled. 3 days later, that more than doubled again. When we are seeing this rapid rise in the tip of the iceberg that we are getting test results back, it means the bottom of the iceberg is pushing it up. And we're still getting a lot of disease spread, even despite our efforts. So early on, when we were having issues in Colorado and just having a scattering of cases, state and local public health agencies were attempting to contact those cases individually, tell them about their infection, and try to identify who they might have been, who they might have exposed, and to try to intervene and ask those exposed persons to stay home. We then expanded that work to start using very public messaging about staying home when you're sick, regardless of what your symptoms are, if it might be COVID infection. The concept of social distancing and staying 6 feet away, and using self-quarantine, meaning if you think you are exposed, stay out of public places and monitor yourself for 14 days, which is a time that it takes if you've had an exposure before your symptoms might develop, up to 14 days. But yet, despite those efforts, the iceberg kept pushing up. We are starting to see more sick people, more hospitalizations, providers seeing more patients with illness that could be consistent with COVID. We've been observing what's been going on in other states. There's a lot of lessons learned in other states around the country, like California and Seattle and New York City, about when they hit this acceleration phase, what might happen. And so, as Dr. Douglas carefully explained, we are now at a point where we need to step up efforts once again. The disease is still spreading despite our efforts. We are having issues with noncompliance and people not following and heeding our advice. And so we need a more widespread and a more strict measure in order to break the chain of spread. We are doing this simultaneously with other counties in the Denver metropolitan area. Why? Because we are a densely populated area. We have a lot of people that live in the metro area, and we were trying to do this in conjunction with our partners in the area so that geographically in the metro area, we ask people to stay home. We want to limit the destinations that people are permitted to go while sustaining essential services for medical care and what's necessary for daily living, so that we can try to have a sharp impact on this disease spreading and to keep people away from one another and to keep sick people at home. So I'll stop my comments there. Thank you very much.
Thank you very much, Dr. Albanese. I want to emphasize, as Dr. Albanese said, one of the biggest issues we've had has been testing inadequacy. And even though the testing measures that she cites are really quite dramatic, we know that those, as she, I think poignantly put it, tip of the iceberg, not giving us anywhere close to the true picture. And I think maybe quite important to emphasize, a test that's positive today represents an event that probably happened 10 to 14 to 17 days ago in terms of transmission, because it takes you a while, 7 to 10 days after you were exposed, to get sick. And then it takes you a while after you get sick to get into a place where you can be tested. And then it takes a while for us to learn about those test results. So that we are working right now with what we think is what we know is a growing epidemic, but what we know is only partially and retrospectively measured. And I think for me, that combined with what I was hearing from my hospital partners about literally weeks away from getting overloaded is really what led me with my other public health partners in a coordinated way to take this action today. Again, thanks, Dr. Albanese. Thanks to Becky for organizing this. And I think, Becky, I'd be happy to now, with Bernadette,
answered this question from Kathy at KOA about why this timing is so critical, referring to the timing of this public health order. Would you mind answering that briefly again?
Yeah, sure. The timing is not driven by Swiss watch mathematical precision. However, it is driven by daily drumbeats of increases in the epidemic and projections, both by models from other places, by experience in other cities, and by modeling that's been done in Colorado, that we're probably literally weeks away from a situation where hospital capacity gets exceeded. So should we have acted a couple of days ago? Maybe, probably so. Do we lose time with each day that we fail to act? I think we do, and that's why we're acting today.
Great, thanks, Dr. Douglas. The next question comes from Colorado Community, and we're going to have Melissa Sager, our policy expert at Tri-County, answer this question. There have been questions raised about Tri-County's authority to do this, especially as a non-elected group making an emergency order. Can you address those questions? Melissa?
Actually, John may be the best one to answer this.
Okay. John, can you answer that?
Sure, yeah. Let me clarify one thing. This is not a declaration of emergency by Tri-County. This is a public health order. We have a national, state, and each of our 3 county declaration of emergency. We're authorized by Colorado statute as the health department of the jurisdiction to issue public health orders when they're needed. There are a number of statutory elements. I'm not a lawyer. Our lawyer tells us that revised statutes 25-1-506, 508, 509, and 516 contain the language that allow us to take these orders. Once again, not a declaration of emergency. That's not our job. But issuing public health orders to reduce a public health problem, in this case, stemming a pandemic, we do have the authority to do that as the district health department of record for these 3 counties.
Thanks, John. This is Melissa, and I'll just add that that particular section that you referenced of law passed in 2008 under the Public Health Act, and again, the authority being in public health emergencies to issue these orders.
Dr. Douglas, we also have another question about the order from Ellis Arnold at Colorado Community Media. Is the list of essential businesses the same between Tri-County stay-at-home order and Denver stay-at-home order?
The list is as close as we could get it. I think it's about 99.5% the same. There are a few variations between us and Denver. There are no variations that I'm aware of between us, between Jefferson County, Boulder County, and ourselves.
Great. This next one is from Connor at Denver Westward, also for Dr. Douglas. Why did you include recreational marijuana shops and liquor stores as essential businesses? Was your decision guided in part after seeing the chaos that happened in Denver?
We were, you know, I think you could argue that neither of those things is as essential as groceries or pharmaceuticals. We were trying to be attentive to coordination. I think one of the concerns was if one county closed liquor stores and another county didn't, that there would be disproportionate social movement of people who frankly wanted to buy alcoholic beverages there. And we would do a better job of, if you will, spreading things out. Our goal here isn't to deny people alcohol or marijuana. The goal is to try to spread things out and prevent social contact. And we thought we could do the best job of that by being as consistent as possible with Denver.
Great, thank you. Our next question is from Kara Mason with the Sentinel. Some local leaders have expressed concern over a patchwork approach. Is a local approach best from a public health perspective, or would it have been better for the state to issue something more broad?
Honestly, we think the more consistency there is in places that share a transmission community and share healthcare resources, the better it would be. That's why we tried to work as closely with our Metropolitan Health Department partners as we did and have. And frankly, why I think a statewide order could have been and would still be an advantage in terms of working together clearly, effectively, and protectively of healthcare resources.
Great. This next question is from Dana Caulfield. These three county groups now will shelter in place 7 days past Denver. Is Denver expected to realign?
At this point, I don't know whether Denver's expected to realign or not. We're in regular communication with our colleagues in Denver. We'll be looking really at many of the same metrics in terms of transmission prevention or transmission reduction and hospital surge. So I guess the best thing to say is stay tuned. They might extend. I certainly wouldn't want to speak for their department or the mayor. We might reduce the duration of this. Once we are convinced that we've got evidence of reduced transmission and evidence of bolstered healthcare capacity, I don't want to leave this in place any longer than we need to. So I think further alignment in either direction is certainly a possibility.
Great, thank you. This next question is from Katie Weiss at CBS, but I don't think we can answer it because it talks about a specific living facility. So Katie, we will get back to you on that. The next question is from Stephen Vetter. Are there going to be any additional announcements concerning narrowed down location of infection cases? For example, towns and communities. I can answer that one. It's on our website, all of the towns and case counts by city and county. I know there are HIPAA and other privacy mandates to be adhered to, but how does mentioning towns or communities jeopardize that? It doesn't. That's why we put those on our website. There have been a bevy of questions arising from the closure of a few businesses in the 6 towns along I-70 immediately east of the metro area, and there are unconfirmed reports that employees of those businesses have been infected. Dr. Albanese, can you speak to that at all?
Peggy, can you repeat that question? Because I'm having a hard time finding it in the chat. What was the question again?
It's a really long question, but there have been a bevy of questions arising about the closure of a few businesses in the 6 towns along I-70 immediately east of the metro area. And there are unconfirmed reports that employees of those businesses have been infected.
So I don't think during this conversation we can get into the details of any particular investigation. Please realize, though, that the persons being tested do not represent everyone who has COVID-19 in the Tri-County area, the metro area, or in Colorado. We are doing this broad swipe of stay-at-home public order to keep people who have milder symptoms home and keep them away from other people so that we don't continue spreading infection, and to really kind of, as Dr. Douglas mentioned, sort of make room within our healthcare system so that people who are having a harder time with their symptoms, a harder time managing their symptoms, creating complications in their underlying illness, people who are maybe developing pneumonia, to make sure that they can access care and be appropriately evaluated and taken care of. And so you can expect that people on your block or people that have in your workplace or that people that you have socialized with either have COVID now, have COVID